We set up Healthcore because we saw that there is a demand gap in care across Southeast Asia especially, although we see a global trend in terms of increasing number of people suffering from chronic disease, moving from the communicable disease pattern to non-communicable disease. What's alarming is that we see that the aging population is increasing while accessibility to care for chronic care diseases and also for the aging profile of patients is becoming less and less because of remote distances or facilities, especially hospitals which have centralized care for a long period of time. So the core vision of Healthcore is to look at the gaps that exist in terms of accessibility. We see multi-specialties or single specialty centers being very important. Decentralization of the hospitals are key where we stand as investors. And this is the long-term view of the team at Healthcore that we move forward into regions of Asia, countries like Vietnam, Myanmar, Cambodia, where there is a pressing need for us to look at chronic care disease management. So in essence, Healthcore has been envisioned to provide multi-specialty care in standalone units away from the hospital environment and to make sure that it is at the accessibility point of communities who need such care. We look at obviously the returns of investment in whatever we do. Most importantly, the strategy here is to enhance social impact in terms of disease management. When we have set foot ahead with our maiden investments in Southeast Asia, the investment strategy looks at how we fill gaps in the environment where there's been minimal investment in areas which are of highest need. So if there is a multi-specialty that is required, or a specialty that's required, or even a subspecialty that's required where there's a lot of centralization which hasn't addressed single specialty needs, this is where Healthcore will focus on investing, because we feel that the general hospital or the tertiary hospital or the secondary hospital environment has become saturated with investors focusing too much on the central model, while we see a gap that needs to be addressed in a specialty area which is still lacking in many societies, countries in Asia. Essentially, Healthcore is Asia focused. We work all the way out from the Middle East to Southeast Asia, including South Asia as well. We have obviously studied the investment environment, and we also have studied demographics and population health in many different countries around Asia. What we feel is having strong links in Vietnam and having good market knowledge in Vietnam, and of course understanding the investment environment in Vietnam. Our maiden investments will be in Vietnam to look at single specialty centers, which we have identified in some major cities to be pilot investments for us. We hope that the Vietnam model will be a good pilot for us to then expand into the region as we see similar needs in countries like Indonesia, Cambodia, Myanmar, the Philippines, and even Malaysia.
For a Healthcore perspective on accessibility, that means that in terms of the location, people can access easily without going out of the countries to receive a specialty treatment, which is a very high cost for them. And the second one is for the people to be able to access at affordable price.
With Healthcore Investment in Vietnam, we find that the chronic disease is better managed, the aging population is taken care of, and the wellness of populations in Vietnam being fulfilled.
What we hope within the next 5 years is to have a success story in Vietnam, and of course then to look into expanding within specialties across the region as well. So it is a very interesting, exciting time for us in Healthcore as we embark on a new journey. It is a path that not many have taken in terms of managing single specialty chronic care in countries like Vietnam. So all of us at Healthcore are looking forward to this exciting journey of impacting the healthcare ecosystem, but most importantly making a difference into creating healthy aging societies and managing chronic disease so that young people can continue to be productive and do nation building in their own countries.